First of all, Gemar Chasima Tova to everybody. I know it's a time that we have loads to do, not that we don't always have loads to do, but certainly at this time of year. Everybody should have a good Gebench. As always, this is being recorded, and it will, upon its completion in the next few days, maybe right after Yom Kippur, it will be posted on YouTube, along with our other, I think it's nine topics that we've already done. I highly encourage you to send questions to us. My plan is eventually to address all the questions, organize them and address them on each of our different topics. And obviously, if you have any ideas for future topics, we would love that as well. With that said, tonight we're going to discuss contraception in Halacha, birth control in Halacha. Before we do that, before we get to each specific birth control method, well, we need to speak about the lead up to birth control. You know, what is our obligation? When could we use birth control? Under what circumstances? And then we could look more closely at each different birth control method. With that said, I'm going to start off with just one simple little question, because they're never ever little and simple. In Parshas Bereishis, you have the pasuk of PUAH. In Parshas Noach, again, you have a second time the mitzvah of PUAH mentioned. First, I'll ask, what is the mitzvah of PUAH? And what is the difference, and what is the difference between the first one and the second one, and why do we actually need two different psukim to tell us?
That's a good question. Why do we have two psukim to teach us PUAH? Why don't we just have one pasuk? I think the classic answer, the classic approach, Chazal tell us, is one is a bracha and one is a tzivui. The first time it's teaching us is not commanding us to be fruitful and multiply, but rather giving us a bracha, that we should be fruitful and multiply, similar to what we find around the Rosh Hashanah, the Yamim Noraim, that we give each other brachos and we eat simanim, that we should be fruitful and multiply. That's a bracha in and of itself. And I think it's actually a very beautiful way to introduce tonight's session, that having children is a bracha. You know, having children is a tremendous bracha. As someone who, you deliver babies every day, someone who is, I'm involved in infertility every day. So from one spectrum to the next, we see how we can't take anything for granted. And we recognize the tremendous bracha it is to have children. And I think that that's a nice introduction to our discussion about birth control, family planning, contraception, and when not to have children. We have to bear in mind that the beauty of this world and the mitzvahs that Hashem gave us, and the Jewish family and the Jewish culture and the Jewish tradition, recognizes and celebrates children. And like everything else in life, there is a balance. So I think that tonight's talk and future talks, we're going to have to weigh the mitzvah element of having children, recognizing the bracha that Hashem bestows upon so many of us, Baruch Hashem, and for others, you know, not yet, but we're still waiting for that bracha. And then also the tzivui, the commandment, and the recognition that we have to balance life, our family, our spouse, our children, our emotional health. A lot of different factors play into this very sensitive topic of birth control and contraception. But to answer your question and then kind of reopen the discussion, one is for a mitzvah of a tzivui, of an obligation, a commandment to have children. And the other is a bracha that Klal Yisrael as a whole, that us families, personal families, and as a whole, we should be fruitful and multiply. We should be gebenched with children with doirei doros, which is can't have a more beautiful bracha than that.
We should all have that bracha. I know that we don't really need to mention it, but sitting in our seats, you know, where we see the opposite, where people are struggling to get pregnant, you know, and it always, in my mind, goes back to a Rav in Rebbetzin that I took care of, who was married for 23 years before they were able to have a child.
Wow.
It was a very, very well recognized case in Far Rockaway. And it was an unbelievable for the entire community when they had a child. What they had the trials and tribulations that they had to go to finally achieve that goal sometimes enters our discussion when we talk about birth control, about trying not to have a baby. So we always keep in mind, and we always have to keep in mind those who are struggling. And they're your neighbors, they're our friends, they're our patients, and it's every single day. And we keep that in mind as we go through this whole discussion.
Yeah, yeah.
So what is the mitzvah of PUAH?
The mitzvah of PUAH, as discussed in Chazal, is after a lot of discussion and a lot of debate, we generally assume the bottom line halacha is that a man is obligated to have a boy and a girl, a son and a daughter. And according to almost everyone, at that moment where the father has a son and a daughter, so the father is Makayim, he fulfills his obligation, his biblical commandment to have children and procreate, Puruvu Umeluas Aretz, we keep short. That's the mitzvah, a boy and a girl. There are other opinions, 2 boys, it's Mishnah and Yavamis, but what we paskin, a boy and a girl, that's the mitzvah.
And that today is pretty universally accepted as a mitzvah. And as you mentioned, it's the husband or the father has fulfilled his obligation. A woman doesn't have an obligation to have children?
A woman doesn't have the mitzvah of PUAH. The mitzvah of PUAH was given to man and not to a woman. Now, it takes 2 to tango. You can't have PUAH without a wife. Your husband can't have PUAH without a wife. Although the Rush comments you can, maybe with a pilegesh, but certainly nowadays you cannot. And therefore, the woman is certainly a critical ingredient, a necessary component in the mitzvah. The Ran famously writes that she's obligated for some other reason, whether it's sheves or she enables and facilitates the mitzvah to come to fruition. So therefore, she certainly has some type of chelek in the mitzvah. You can't push a woman to the sideline and say that you're insignificant. But in terms of the cut and dry mitzvah of PUAH, so it's accepted that a woman does not have an obligation of PUAH. The Meshech Chochmah writes something amazing. The Meshech Chochmah says that the reason why the Torah could not command a woman to have a baby, the Torah cannot command a woman PUAH, is because pregnancy and delivery, labor and delivery, is something which is painful and something which is dangerous, but more painful than dangerous, I think. And since we know diracheha darchei noam, since the ways of the Torah are sweet and beautiful, it can't be, argues the Meshech Chochmah, that the Torah would obligate a woman on the mitzvah of PUAH because she has to endure the tremendous amount of pain through the pregnancy and the labor and delivery. So of course, again, she's necessary. She's that critical component and we can't do without her. But in terms of the mitzvah of PUAH, the Meshech Chochmah writes, and everyone agrees, that there is no mitzvah for the woman when it comes to the mitzvah of PUAH. That is the husband's mitzvah, that's the father's mitzvah. The woman facilitates, but it's his mitzvah.
Yeah. Just going back to something that we've talked about in the past, in regard to induction of labor, one of the reasons why we only induce labor when we have a very strong reason is because having a baby, God wouldn't put her in sakana.
Right.
So it comes in the right time. So we don't want to change the right time unless we have to, unless we're guided to do it, because we might be putting in a sakana that she wasn't in before.
That's right. I'll give you one nafkamina, just a real life example that highlights the mitzvah of the PUAH's mitzvah being the husband's mitzvah as opposed to the wife. Suppose you have one party, then let's say we're dealing with a case of infertility, and one party is, there's one reason why there's infertility. It's either a male factor or a female factor, suppose in this case. So, and let's talk about an extreme case where there's no sperm or no eggs, okay? And therefore the couple asks if they could pursue the route of donor sperm or donor egg. So it's interesting. If you are trying to justify, some of the poskim, they want to justify that quote unquote controversial technology, artificial reproductive technology, a third party, they want to justify that because there'll be a kiyum, there'll be a fulfillment of PUAH down the line. So If it's the wife, who doesn't have eggs, but the husband has sperm, so then if they use let's say a Jewish donor egg, and they use his sperm, he'll be able to fulfill his mitzvah, and we could kind of check the box of pru'uvu, because the husband's going to be able to have his child. But in a case where the husband is azospermic, he doesn't have sperm. So the donor, the controversial, I'm just saying, quote unquote, controversial process that they want to pursue is for her to have the baby, but it won't be his sperm because he's azospermic. So you can't justify that under the umbrella of pru'uvu, because it's not going to be his sperm, and she doesn't have a mitzvah pru'uvu, and it won't be his sperm. So it does make a difference, looking at whose mitzvah is it, and what exactly are we doing, whether or not there will be a fulfillment of pru'uvu.
In a few minutes, I want to come back to that whole concept. Just a couple of other things before we get there.
Sure.
Which is what happens if somebody has 7 girls in a row?
I have a cousin who had 7 girls in a row. This is not far-fetched,
I mean, that last week we had somebody with 5 boys in a row, and now they have 5 boys and a girl. We've had people, and I don't remember what the highest number, but in my mind, it's 9 or 11 of the same gender in a row before the other gender. What happens if you never make it to have the opposite gender?
Right. So listen, as involved as you are in fertility, and as involved as I am in fertility, there's no one more involved in fertility than the Ribono Shel Olam. HaKadosh Baruch Hu is the one who is running the show. No questions asked.
Correct. If you don't know that, then we're really in trouble.
That's right. If a woman gets pregnant, when a woman gets pregnant, with whatever gender she gets pregnant, that is not up to us. Sometimes we can manipulate it. Sometimes we can introduce man-made science, a gender selection. And I'm talking all natural, a natural conception, without going to IVF discussion. Maybe we'll get there, but just without that, whether or not you have a boy or a girl is HaKadosh Baruch Hu. It's true, the Gemara says, there are certain tips to try to have a boy or a girl, etc. But what the actual gender is going to be is determined by Hashem. So the very Hashem that commanded us to have a boy and a girl is also dealing the cards, and he knows what cards he's dealing us. So certainly after 120, when we reach the Kisei HaKavod, the truth is, the Gemara Shabbos tells us, Lamed Gimel, I think, Lamed Aleph, Lamed Gimel. The Gemara says that at the end, when we come to the Kisei HaKavod, Hashem is going to ask us a series of questions. And one of the questions that Hashem is going to ask us is, Asakta b'peri v'rivya. Yep. But the Gemara doesn't say, Kiyamta peri v'rivya. The Gemara doesn't say, were you Makayim? Did you fulfill pru'uvu? The Gemara says, Asakta b'peri v'rivya. Were you engaged in peri v'rivya? Were you actively trying to have a baby, a boy and a girl? If the answer to that question is, yes, I was osek, I was involved, I was engaged, I was trying, you, Hashem, were the one who gave me 7 beautiful girls. I couldn't have my son. So we answered correctly. He asked, Asakta, were you engaged? Yes, we were engaged. If he would ask, were you Makayim? So we would say, listen, we weren't Makayim, but again, what can I do? Ones Rachmana Patre. When there's an ones, when it was beyond my control, so we can't take the blame for that. The very Hashem who gave us this mitzvah didn't give us the baby girl, the baby boy, whatever it is. So it's, we can't say that the person was Makayim pru'uvu. A couple has as many children as they can possibly handle, and it's all the same gender. It's hard to paskin that person completed his and fulfilled his mitzvah. But certainly, ones rachmana patre, certainly he would never be penalized chas v'shalom for that, because it's way beyond his control.
With that said, these next two questions are connected. After you've been, let's say you have one boy and one girl, your first 2 children, and say, listen, I'm done. I'm a kayam, my obligation, but. Are you just able to stop there and say, hey, I have 2 kids? Or is our obligation in general to continue to have children? And then the second question, which is connected to what you were just saying, Osek, when does Osek finish?
Yeah.
finish at 35? I tried, but when I turned 35, I stopped. Or do I have to just keep trying until I'm 55 years old and daven every day that it works?
Yeah. I'll throw another question.
Sir?
Just because while I was thinking about it, while I was talking about having so many children of one gender, could you possibly argue that there would be, I don't know how we would say it, an obligation, a recommendation to go ahead and do IVF and to be able to select the gender? Listen, Ruvain has 6 girls, 7 girls. He wants a boy. He's okay with 8 children, but statistically, you've had 7 girls. Statistically, your next kid is also going to be a girl. It's possible that it will be a boy, but statistically, it might be a girl. So in order to not enter that situation where he's just rolling the dice, but he'll go to the fertility lab and create embryos and pick out the male and do that. What's the level of either obligation or expectation that they would do that so that they'll be able to have that mitzvah of pruruvu?
Well, that's just to throw on top of that. Even if they wanted to do it, what does halacha say? Could they go ahead and do that?
Right.
Someone says, I have 4 girls, I have 4 boys. I would like to have a girl. If I try naturally, it's a 50-50 chance, or if you argue 49-51, whatever you're going to argue. But if I go and I spend $20,000 to $30,000 and do in vitro, I could guarantee, assuming a pregnancy, comes to fruition, what the gender is going to be.
Right.
Not only so there's one question: are they obligated to do that? And number 2 is, are they actually allowed to do that if they just wanted to do that?
Right. In terms of the obligation, it's very hard to say that there would actually be an obligation, because the Torah would not require us or obligate us to do something which is shelo b'derech hateva.
I've never had anybody come into the office and say, my Rav says I should do IVF.
So to say that you're obligated, that you're mechuyav to do IVF, the truth is, let's take gender selection off the table just for 1 minute. What is the level of obligation of a young couple who's unable to have children, and the only way that they could have children is IVF? So is there an obligation? Do they have the same level of mitzvah, of chiyuv, of pruruvu, now again, the only way that they're going to have their children is through IVF? Do they have the same chiyuv as a couple that doesn't have those fertility issues and they're going to get pregnant naturally? Is it the same chiyuv? Or at a certain point do we say, no, there can't be a chiyuv for you to do something beyond what's normal derech hateva? Derech hateva is normal intercourse with husband and wife. Now, Baruch Hashem, we live in a society, we live in a generation that we have access to the most amazing medical technology, where a couple that would otherwise have not been able to have children are now able to have children, and it's miraculous and it's amazing. And mo rabu masach Hashem, we thank Hashem every single day for this, for this medicine. But are we able to say that it becomes a chiyuv, an actual obligation? Most poskim, almost everyone, is of the opinion that you can't say that there's a chiyuv, that there's an obligation. You can't force and require and obligate a couple to do IVF because it is shelo b'derech hateva. It may be normal, it may be accepted, it may be totally out there, but it's still shelo b'derech hateva. However, I spoke to Rav David Cohen about this a number of times, and Rav David, I've asked this question about gender selection, and Rav David told me that if there's a couple that have one gender, many boys, many girls, whatever it may be, and they want to do IVF because they want the other gender. So Reb David said it's mutter, and they'll be makayim a mitzvah of pruruvu, and they should go ahead and do it. I even asked him a few times, Reb David, can I publicize this? Can I publicize this? He says, yes, mitzvah lefarsem. Tell people they can do it if they want to. Now, other posts can disagree. It is not unanimous one bit. However, that was the opinion of Reb David Cohen. And sometimes the truth is we're talking about a person who, quote unquote, wants to have a son, wants to have a daughter. I once had a case where a woman She calls me crying. She needs a daughter. She needs a daughter. She needs a daughter. And I asked her, why do you, where's this pressure coming from? She said, you want to know where the pressure is coming from? My family is in the girls' clothing business. So to have boys and not, if you have a girl that I'll be able to use our family business for the clothing is just unheard of. You couldn't handle it. But that was one unique case. But many times you have real societal pressure, real social pressure of, many times fathers are broken, that they only have daughters. They don't have sons to take to shul, and all the learning programs are for sons and fathers. And for women as well, it's hard for them not to have their daughter. So we have to take in the emotional, that emotional difficulty, in mind. But there are poskim who do permit IVF for gender selection. Going back to the PUAH question, there certainly would not be a chiyuv because their hands are tied. What Hashem gives us is what Hashem gives us. But you had some other questions. You had some other questions that I did not answer, I don't think.
So again, there are connected questions. We're talking about osek. When does your osek responsibility end? You want to answer, listen, I tried for 10 years, I tried for 20 years, but now you're 48 years old, and your wife is 45 years old. Do we say, okay, you now is time to shut it down. Now is time not to pursue any more children. And then obviously we could look at 40 years old, 35 years old, like where does a 35 years old and you have 8 kids, like when does your obligation stop?
So are we talking about a case where a person has a boy and a girl, or where a person has a boy and a girl and another boy and another? They have 4 kids, 5 kids.
It started off is if they have one boy and one girl plus other kids, right? And they're encouraged, to keep having children. When does that obligation stop? And then the second question is if they have 5 boys and, where, again, using the word osek, we kept trying. When do you say enough is enough? You don't have to try anymore.
Insofar as the mitzvah of PUAH is concerned, so they're yotze after a boy and a girl. There is another mitzvah of le'erev al tanach yadecha that you shouldn't not have any more children. The Jewish people will not survive if everyone just has one boy and one girl. Le'erev al tanach yadecha, we have to be engaged in populating the world.
If you have only one boy and one girl, you're basically replacing yourself. But knowing that people have problems in the next generation, well, we're not really even replacing ourselves at that point.
Right. So mitzad the mitzvah of le'erev al tanach yadecha, there's an obligation to have more children. Now, where's the cutoff? So that's a very complicated, sensitive question, which really is a personal question for each person, each family, knowing what their limits are, what their emotional limits are, what their financial limits are, how much attention they're able to give to their children, how much, the environment that they're able to raise their children in. Unfortunately, we're seeing a lot of mental health issues now. And as wonderful and beautiful as bringing more children into the world is, sometimes we see it's coming at a cost, and a difficult cost to parents' well-being and, quite frankly, other children's well-being. So it's much easier to deal with the shaila once a couple has already been makayim PUAH, they already have their boy and their girl. And then, we can discuss when is the right time to take a more, long-term birth control option, which we'll talk about different options later. But up until a person is not, if a person has not yet been makayim PUAH, so then it becomes a little bit more complicated because they really do have that mitzvah that they should try to fulfill. Now, we're never obligated. I'll just end with this: we're never obligated to go beyond our means. Even when it comes to a mitzvah of tzedakah, we want to give and we want to give and we want to give. But there, the Gemara says so clearly that a person can only give chomesh. You're only permissible. It's only permissible to give 20% of your assets. You can't give more, right? Even if you wanted to. Okay, different outlier situations. But for the most part, you don't give to fulfill a positive mitzvah, you don't go beyond 20% of your assets, of your capability. So many of the poskim say that here too, that this is talking about the obligation, the fulfillment of a positive obligation, just like tzedakah. So there's PUAH. You're not obligated to lose your mind completely. You're not obligated to give up 20% of your assets for a mitzvah say. So the equivalent, however you would calculate that in mental health or your sanity or whatever it may be, whatever, can I afford this? Not necessarily financially, but can my whole life afford this? You're not obligated to go beyond 20%. So we definitely see that there is a cutoff. At a certain point, we say, listen, I don't have to proceed. I'm allowed to abstain. I'm allowed to refrain. I'm allowed to just hold off at this point. And the difficulty is calculating a chomesh, calculating the fifth. That's a sensitive and difficult question that should be brought up with the Rav. But people should know that there is a cutoff. We don't say that when do you finish the mitzvah PUAH on your dying day? That's not the case.
In my mind and over time, I've read that there are other ways or that you might be able to fulfill your PUAH obligation. I've read in the past that if you can't have children and you adopt children, I'm just going to run through a few of the ideas that I've read. Support fertility patients. You can't have children, but you help other people have children. Doing kiruv work, bringing people into Klal Yisrael, well, getting them back on the derech, teaching Torah to people who don't, and making shidduchim of different. Along the way is a list I compiled of ways to be able to fulfill PUAH if you can't the regular prescribed one boy, one girl way.
The emes is, I think everything that you mentioned is sourced in Gemara. Whether it's Magadel, Yosam, Besoch Beso, if you raise someone else's child or an orphan, it's like you gave birth to them. If you teach them Torah, it's like you gave birth to them. The Maharsha in that Gemara in Shabbos that says Asakta b'piri v'rivya, right? When we go up to Hashem after 120, so the Maharsha there says that what Hashem is asking is, were you osik b'shidduchim? That HaKadosh Baruch Hu is going to ask us, were you osik in shidduchim? That's what's going to be one of the questions. One of the 6 questions that we're going to be asked after when we present in the Bezdin Shalmala, we're going to be asked if we were osik in shidduchim. It's a tremendous musar for everyone to recognize the importance of helping someone who is single, someone who's not yet married, helping them find their shidduch. That's going to be one of our questions. So yeah, all of those are sourced in Gemaras. But I don't think it actually compares to the actual mitzvah of PUAH. That the actual mitzvah of PUAH is having a child. The other ones again are more of a hashkafic and agadic approach, which are true. It's all emes. It's all mentioned in the Gemara, but it's not the same mitzvah of PUAH.
Now turning to birth control.
Okay.
A statement: birth control in halacha is generally not recommended, except in each individual situation. It gets evaluated for each individual situation. So there's no blanket, yes, we do birth control, no, we do birth control. We look at each individual person. Blanket statement.
Yeah, I'm okay with that.
Okay, and we look at basically 3 different things: the woman's health, emotional well-being, and a break between pregnancies. Is the basic reasons why Rabbanim will approve birth control in certain situations.
Yeah, the question is, once we have a mitzvah of PUAH, how can we justify actively preventing a pregnancy? How can we justify that? So the sugya, I believe, is discussed in a few places. It's a Gemara in Yevamis, and Mishnah Yevamis, and Ksubis. Yevamis Yud Beis, I believe. And there the Mishnah talks about Gimel Noshim Mishamshos B'moch. The Gemara was familiar with contraception. And there is a machlokas in the Rishon, and what does it mean to be Mishamish B'moch? What does it mean to have relations with a moch? So Rashi, I think, understands that that a woman inserted some type of material, some type of something like a diaphragm into the vaginal area, and that way, when the husband ejaculated, he would ejaculate onto this tzemer, let's say with this cotton or the wool, whatever it was, and then she would pull it out, so that when so that there wouldn't be a pregnancy, all the zera would be taken out with the moch. I think Rabbeinu Tam has an issue with that, and he refers to wiping herself after the act. After the husband ejaculated, she should stand up and she should wipe herself. That was what the Mishnah was talking about. But be that as it may, the Mishnah refers to a case where birth control some method of birth control can be practiced, and the Mishnah talks about cases of extreme illness of a person, the real sakana. If a person were to get pregnant, then there would be a real illness. It would be a real, it would be a dangerous situation. So I think the sugya really begins justifying birth control. It begins with some type of choli, physical choli, of course. And the question is whether can we extend that to emotional choli, right? Psychological choli. At what point are we comfortable saying, yes, you can abstain from children, you can prevent a pregnancy, and then again, we're assuming that we're just talking about pregnancy. We're not talking about shechva zera levatala, which is another consideration when discussing birth control. But I think you're right that many Rabbanim will start their whole attitude and their whole focus and perspective will be, we need to justify this. What's the justification? What level of choli are we dealing with?
Okay, so let me ask you a question that we discuss often at our Shabbos table. You should only know what we discuss at our Shabbos table.
Right back at you.
The newly married couple. Unfortunately, there's a crisis of people getting married and getting divorced within the first year. And it's real, it's there, we're involved with all of it, and it's not just one person. And it so hurts to see how many people go through this. I would give advice. Maybe it's a good idea not to get pregnant the first year until you know each other. That's called advice. That's not a halachic view. So what would be the halachic view to the couple who's married? Is it justified that they go on birth control for 3 months, 6 months, 9 months, 1 year, depending on the couple, or is that not a fair to start off that way?
As you said in your words of introduction, every case is unique. Every case has to be considered and dealt with.
But every at the chasana, everybody is happy as can be.
Yeah. True, that's true. But still, I don't think, even just like birth control as for a married couple of 3, 4, 10, 12, 15, 20 years, just like there's no cookie cutter approach. Everything has to be weighed and considered and taken into account. Similarly, a chassan and kala who are getting married, if that's something that that they want to consider or to at least to explore, so they should speak with a rav, and the rav who knows them, and the rav who knows them should assess and evaluate them as a couple, either him or her or them as a couple, and whether he thinks that, again, we're talking about a choli, we're talking about an emotional choli. Maybe we're not talking about diagnosed anxiety or OCD or depression or whatnot, but there might be certain red flags. Might be something this and that. So I don't think that it's so off the table for a rav to perhaps to permit such a thing. I'm not opposed to that if the rav feels that it's appropriate. I'm not sure how comfortable I am with a blanket heter. Anyone who gets married, welcome to 2023. You get married 6 months off the bat. That's I don't know if that's a healthy approach to marriage. I don't know if it's a healthy approach to birth control. I don't know if that's the message we should be giving our young chassan and kalas. Good luck to you both. I'm just letting you know, go on birth control. I'm not sure that we're giving them the most encouraging beginning. But if a Rav knows them and sensitive to something, then I think that it is justified, can be justified, certainly.
So in the chat, there's just a little comment. My husband had a brief marriage before we got married. I see it all the time. I think everyone should consider something or other, whether it's 3 months, 6 months, or so on. I go, these are real.
Yeah.
Yeah.
I am certainly not discounting, or I'm not validating any of the real situations. I myself, as a Rav, as a Chazan teacher, am involved with them all the time. That being said, for every case that we hear about them, there are many cases where the couple didn't get divorced and the couple are very happy. So I'm not saying that we should. I don't think as a blanket protocol. The chassan and kal, they come to the Rav to tell them they got engaged. Mazel tov. I don't think the Rav should respond. Mazel tov. You should be matzliach. I'm so happy for you. Dr. Herman is a fantastic physician. Go make an appointment so you can get some birth control. I don't think that that's an appropriate response. That a Rav should just or anyone should be, responding right off the bat. Now, if when they come to meet with the Rav and they explain why they want to do this, if the Rav feels that, wow, your explanation is validated, then I think that there is room to be meko.
Just like I said, we hear these issues, and they're real issues, they're real palpable issues, and it's something that we talk about a lot.
Someone in the chat wrote, someone that had sexual trauma and in the past and wants to get to know their partner and feel safe before having a child. That's an example. That's a classic, great example where we're not dealing with the cookie cutter chassan and kala that's getting married with no issues and No, there's baggage, there's history that's important and significant. We're touching on something very sensitive. I personally, if such a couple came to me as an engaged couple, I would certainly permit it. And then based on their situation, we would discuss the length, how much time.
So, okay. This probably was the longest introduction to a topic that we've ever done. 53 minutes of introduction. Okay, birth control itself, and I am reading the chat as we go by, but I really want to get to my first initial thing.
Yeah.
Okay, we have different forms of birth control. In fact, I have a list of 13 of them in front of me. And the first one of all of them is the use of condoms. So, okay, so we went to the Rav, we sat down, spoke to the Rav, and he says, okay, you could, for the next 3 months, for the next 6 months, you could use birth control. And one of the choices we could make is condoms. Why can we not use condoms? And then the second question is, in what cases can we use condoms?
Wow, we didn't even build up to the controversial stuff. You hit the nail on the head.
Yeah, all right. I got it, by the way.
A condom is, we refer to different methods like the barrier method. So the barrier method, at least for a condom, is certainly a barrier method where the husband, although the ejaculation takes place inside of the body, nevertheless, when he pulls out, so the zera is going to come with him. So he's going to be removing all of the zera from osamakum, from the woman, from the vaginal area. At that point, that's shechva zera levatal. It's hashchas zera. He's destroying the zera, since that zera will be discarded. So beyond the whole discussion that we've had up until now, this introduction, there's another consideration which we just touched upon it earlier, but it's the isser of destroying the seed, wasting the seed, destroying the seed, right? There is a mitzvah, and maybe I'll just say this because I think it's important for everyone to know. There is an isser, a prohibition to destroy the seed, to waste the seed. Now, what that means is that any time the zera is not will not end up in the vagina, so that could be a shaila of shechva zera levatala. Okay, that could be a shaila of shechva zera levatala. It does not mean that any zera which did not impregnate or could impregnate a woman is a problem. Meaning, if a woman is pregnant already, She's not going to get pregnant again. Although that Mishnah in Yevamos on Yud Beis that's discussing birth control is discussing a woman who's pregnant and there's a concern that she may get pregnant again. Okay, far-fetched, but it's possible.
And also, you have the case of a postmenopausal woman,
Right.
or a woman for whatever reason can't get pregnant. She was born
Correct.
without a womb. She
Correct.
had to remove.
Correct.
All of those cases.
Correct. So
so
don't think that in order for it to not be considered wasted seed, it has to have had the potential to yield a pregnancy. That's not true. A pregnant couple can have relations, and it's not called shechva zera levatala. Now, however, when it's not going into the vagina, or it's being ejaculated in the vagina, but being pulled out because it's a condom, so then that would be an isra of shechva zera levatala. That's an isra of shechva zera levatala. That is hashchas zera. We are destroying the sperm because he's taking the condom off and throwing it in the garbage. So that cannot be justified in almost all cases, because although there's a mitzvah of ona, we have a mitzvah a man has a mitzvah to sexually satisfy his wife, but that doesn't permit the isser of shechva zera levatala, and the condom would fall into that category.
So number 2 on the list was withdrawal, which we don't even really need to discuss. So he's on purpose, when he's getting close to ejaculating, he pulls out, and okay, so that one we don't need to talk about. How about the rhythm method, fertility awareness? A 28-day cycle, she goes to mikvah on day 12, will probably ovulate around day 14. But they say, okay, let's not go to the mikvah. Let's wait 5 days or 6 days, and we'll pass the time of ovulation, and then you'll go to the mikvah, or we'll go to the mikvah, but we won't have relations until that time has passed.
Right. You should know there is a tshuva in Rav Moshe, Negros Moshe, where Rav Moshe writes that even that requires a heter. Even that requires a heter from a Rav, that a couple can't on their own decide that we are not going to have a baby. We're not going to use a condom. We're not going to go on any contraceptive pill. We're not going to do anything. We're just going to abstain until the moment that we're confident that the ovulation has passed, and then we'll resume tashmish. Rav Moshe writes, even that requires a heter from a Rav. So that's also part of, you behaving in a way, acting in a way that you are preventing a pregnancy, although you're not doing an action. It's a b'shevi al tasi. You're not doing anything. You're, on the contrary, you are not engaging. Nevertheless, Rav Moshe says such behavior would require a heter. So not so pashut that would be an acceptable form of birth control without it having some type of halachic permissibility.
Well, it is delaying in my understanding, just delaying mikvah on its own is a problem. It's a not problem. I guess if they decide together, then they decide together that's okay with them. But
when it comes to delaying mikvah, there's 2 considerations. There's a consideration of puravu, that typically mikvah night is a great time to try to get pregnant.
Just out of an interesting medical thing, they have numerous studies that now show the best time to conceive is if you have relations before ovulation.
Right, that's right.
Not waiting for ovulation to occur.
Right.
It's the 2 days beforehand. There's a higher fertility rate with relations 2 days, which actually puts us right at mikvah.
Correct.
Exactly a couple of days before the egg is coming out.
Correct, 100%. So let's say, and I get this question all the time, mikvah night is Tuesday night, my sister's wedding, my best friend's wedding. So can we push off mikvah? I'll go Wednesday night. Well, there's 2 considerations. There's puravu, right? And if you push it off, we may not be putting ourselves in the best position to get pregnant. And beyond puravu, let's say the couple already fulfilled the mitzvah of puravu, but there's a mitzvah of ona. There's a mitzvah where a husband has to satisfy his wife, sexually satisfy his wife. Now, the mitzvah of ona is the husband's mitzvah, his husband's chiyuv onto his wife. Sometimes the reason why they want to postpone mikvah is because the wife feels uncomfortable. It's the wife's sister's wedding. It's the wife's best friend's wedding. So how could I, says the wife, how can I miss my best friend's wedding? To go to the middle and then the makeup and this, it's going to be too complicated. So for my convenience and for my, relationship with my best friend, my sister, my I want to go and push it off. So people ask me this question all the time, and this is the answer that I give them. If we can work it out from a pruvu perspective, and we can work it out from a mitzvah's owner perspective, and everyone's on the same page, so then there's no reason not to push off the mikvah. They could push off the mikvah. There is a discussion in the Gemara whether going on time is a mitzvah, but we paskin lav mitzvah. We paskin nowadays that going on time is not an obligation. So given the fact that that's how we paskin, those are the two considerations that need to be addressed. And if they're addressed and resolved, then it's not a problem. It happens often around the Yontif season. They don't want to go on the first night of Yontif. They don't want to go on the second night of Yontif. They'll wait till after Yontif. That's okay.
So again, 1, 2, and 3, condoms, withdrawal, and rhythm method. Okay, but there's one other element and that I was going to get to, but I see that on the chat they asked the same question. Is there a difference between a male condom and a female condom? I've only had a couple of patients in my career use female condoms. Actually, I read they're much more common on the West Coast than they are on the East Coast. I don't know if that's true or not. The difference is that she's the one who removes the condom in the end in her time, not him pulling out with the condom. So is there a difference halachically with that?
Again, there's that machlokas between Rashi and Rabbeinu Tam whether a woman is obligated or she's included in the isra of hashchasa zera, of destroying the sperm. But even so, the ejaculation is taking place, in a condom. It's not taking place, in the vagina. It's technically in the vagina, but it's more specifically in the condom. So it's going to be removed. It's going to be discarded. It's going to be thrown out. So it's still a shayla of hashchasa zera, even if it's a female condom.
And he knows it's going to be thrown out.
Yeah.
Just someone asked for a little clarification on when you said what the considerations for pruvu and the timing of going to mikvah. So if you don't go on Thursday night and you go on Friday night in the Sef, what did you mean by saying the considerations for pruvu?
In other words, if I often will ask a couple, is there reason to believe that tonight is the only window of time? That tonight is the only window of time that you'll have in order to get pregnant this month. If tonight is the only window of time that you get that you'll have to be together and you have the opportunity to get pregnant, to hopefully get pregnant, and now you're not going to go to the mikvah because you have a wedding, it's going to be much harder to push off mikvah because this is your only window of time. However, is it possible that tomorrow you're going to miss out? You're going to catch ovulation tomorrow. It might be a little bit closer. It might be slightly more risky, but it's not unheard of. So then I would also permit it. The only time I would really think twice is in a specific case where we know for a fact that tonight is the night. Tonight is the night and no other night. Yep. So that also, even so, that there's other ways to deal with this, but that's a more of a serious shiloh about pushing off mikvah.
Okay, we're going to go through number 4 and 5, and I think that we're going to stop there for tonight. And then
I just want to address one thing that on the chat: the condoms for fertility treatments.
Yes. When can you use a condom?
Yeah, so just to discuss condoms for fertility treatments, because it is common after if a man requires a semen analysis or for a sperm sample for IVF or through IUI, so often the Rabbanim will tell them that the preferred procurement method would be through a condom. Now, the reason why that's okay is because, number one, there's no masturbation, right? We're not, we're not, according to some shittas, masturbation in of itself is an isser, not related to pruvu, just masturbation. Neither Yud Gimel, Amud Beis, the Gemara says, niyuf biyad, is from a pasuk of Lusina, from Moshe writes in Shuva, it's an Isra Daraisa. So independent of pruvu, there's an Isra of masturbation. Now, how can we procure the sample if it's not through masturbation? Well, they can have intercourse. Well, if you have intercourse, how are we going to get the sperm? So sometimes we do some type of vaginal collection, but let's say we need a good quality sample for them to do IVF, for them to do IUI. Oh, well, if you use a condom, so then we'll be able to have the sample. So we already said in our session tonight that a condom is hashchas zera. Yeah, why is it hashchas zera? It's because when a couple that are having regular intercourse at night, so they're going to throw out the condom in the garbage. And since the zera is going to end up in the garbage, that's livatala, that's going to be wasted. But for fertility treatment, where they're going to take that condom and then bring the sperm to the lab and hopefully have a baby with that sperm, or at least test the sperm to see if they're positive, what's the issue, to deal with their PUAH situation. So that's not levatala. So the two reasons why you can't waste sperm, number one is shechva zer levatala, and number two, masturbation. So those can be circumvented if you use the medical condom for fertility treatments. But that's a very different discussion than when we're talking about elective contraception between a husband and a wife and family planning. That would be, a condom would be hashchas zera, which is different than a fertility situation.
Also, just note those condoms are different than condoms they get. You could
very important.
There have been numerous cases of people who did that. Condoms that you buy in the store have spermicide in them, so they kill all the sperm.
I witnessed with my own two eyes. I was in a lab, and I saw different samples being brought in, and I saw the sperm that was brought in from a condom that was bought at a pharmacy, and those condoms are laced with spermicide. I saw under the microscope the sample that was brought in with that condom. Every single sperm was dead. Everything. So the condoms that the fertility clinics give out, the male factor pack, those are medical condoms. Those are not laced with spermicide. Those are the condoms that you need in order to help procure the sample and then bring it into the lab.
Okay. So I when I speak to my patient, I call it a halachic semen analysis. So that's what we talk about. The number 4 and 5 are spermicide and diaphragm, which are essentially the same with the same issues. So here, before relations, the wife is putting in spermicide with the intention of killing the sperm. Spermicide kills the sperm. A diaphragm, a barrier method, and that's usually with spermicide. I put those in the same category. The husband knows what the intention is, knows what the idea is. Why is this permissible in by a lot of Rabbanim?
Well, there might be a difference between a diaphragm and a spermicide. I think there is a difference. The diaphragm could be viewed as more of as the barrier method. It might be like something like a female condom or something along those lines, something inside of the body that is catching the sperm and is not allowing the sperm to penetrate and is not allowing the sperm to go up. So it's essentially like you're being motzi zera, ejaculating onto some type of object. Happens to be that this object is placed in the vaginal cavity, in the vaginal canal. But that's different than a spermicide where you create a toxic environment in the vaginal canal. So that way, when the sperm goes in, the toxicity will kill the sperm and will not allow it to go. But that's different than the man being motzi zera on a diaphragm. There were a number of poskim that forbade the diaphragm. Many poskim said that the diaphragm was usher. And it's not so pashut even today that a diaphragm is mutter. There are poskim who permit it. In certain cases, they will permit a diaphragm. It's usually a good non-hormonal option, when necessary. It's certainly far from 100%. I had 2 cases back to back where women both had medical issues and medical emergencies, 2 different cases. And they one needed an operation, one needed a scan, and the doctor didn't want to do the scan when she was pregnant. So the doctor said, you have to go on birth control. They didn't have enough time to go on a hormonal birth control. So both of them got fit for different doctors, got fit for a diaphragm. Both of them got pregnant, and they had to deal with the ramifications of their procedures or their scans, knowing that they were now pregnant when they were not supposed to be pregnant. So, that was just that story. I can't get it out of my head because, it was a serious medical situation. So people have to know that the diaphragm is not 100%. Neither is the spermicide. Very, very few things are 100%. But I think there is more halachic permissibility and leeway when it comes to the spermicide than there is the diaphragm.
Interesting, because that never really came up with the patients who came in asking for it. So that's something that I definitely have to change when I speak to the patients when they come in.
Have you seen, in terms of the efficacy of the diaphragm and the reliability? How comfortable are you?
Okay, so the discussion that I have with my patients when they come back, let's say postpartum, is this 4 things you could do. Okay, one is nothing, and I always go, I want you to come back three months from now pregnant. You might not want to come back 3 months pregnant, but I would love for you to come back 3 months pregnant.
Yeah.
Breastfeeding alone gives you some protection, but eventually the body figures out it should make eggs again, and you come back. That's number one. Then I call it my 1-year plan. What's my 1-year plan? Is spermicide. Okay, I don't speak about diaphragm because the efficacy of spermicide and diaphragm are very similar, and diaphragm is diaphragm usually with spermicide.
Yeah, it's usually there as well. Exactly.
So spermicide alone. I call that my 1-year plan. Okay, but every year I get patients who come back pregnant on it. So you would like in your optimal world to wait 1 year, but what happens if you get pregnant in 10 months or 8 months? Are you going to come back and say, Hodu Lashem, I'm pregnant, that's great? Or are you going to say this was something very terrible for my family? If you're going to say this is something terrible, we're not going to do that. If you say, listen, I wanted 12 months, but I got 8 months, I'm very happy, then you could use spermicide. That's my usual conversation with a patient. Because it's for a patient who has a medical problem, this is not what I'm going to recommend, nor is it acceptable in practice.
I also just want to point out that when we discuss birth control, going back to the introduction, when we discuss birth control for a couple, so there is a difference between a couple who didn't have a baby yet, right? Even without PUAH, and a couple that's postpartum. A couple that has a baby, the Gemara says that she has a din of a menekes for 24 months, right? For 2 years following the birth. And a menekes, in the Gemara's understanding, is not going to get pregnant. So the Gemara doesn't say that a woman's not allowed to nurse for more than a year because of PUAH. Who gave you the heter to nurse for so long? As long as you're nursing, you're significantly lowering the chances of getting pregnant. So who gave you the heter to nurse? You don't find such a thing. The Gemara is clear that you can nurse, and even if you're not nursing, you're actively, but you're called the menekes for 24 months. So that's also a very important consideration, that after a child, the whole discussion is a very, very, very different discussion. Very different discussion.
I think it's a good time to stop. I'm reading all the chats. I'm taking notes on them because when we pick this up again, we will move on with the rest of the birth control, and I'm going to again keep track of the questions that people had to make sure that it gets incorporated into our next discussion.